Hello everyone, I'm Dr. Divya Sharma, a dermatologist with special interest in pediatric dermatology, trichology and cosmetology. I practice in the heart of city Whitefield in Bangalore. There are so many common questions and concerns that patients put across, and sometimes we are not able to address it during the limited period of consultation. The common do's and don'ts, ifs and buts, which we'll try to address in this series of videos. I sincerely believe an empowered patient is an ideal patient because if you have knowledge, it becomes very easy in the process of decision making. So, patient empowerment is the key to a long term and trustworthy relationship between you and me. Acne is not a disease, it is a tendency. If you go into the depth of it, acne is more skin deep than on the top of it. A lot of factors, play a postulated role in the genesis of acne. It all starts from microinflammation around your oil glands, which triggers, blockade of the oil glands with its own dead skin, followed by inflammation and followed by an outbreak or a zit or a pimple. What are the triggers of the inflammation is a question that has eluded us for all these many years, but what we have found with the latest evidence that your oil gland is like a hormone factory. It has receptors for stress, it has receptors for thyroid, it has receptors for vitamin D, it has receptors for free radicals. So there are multiple factors that play a role in triggering acne. There was a time when acne was believed to occur during teenage years, and it was believed that as you age it would go away. As I said earlier, acne is a tendency getting influenced by many more factors just than your teenage burst of hormones. We rather see now more and more patients coming with late onset acne that occurs after 25, or there are a subset of patients who said, I had acne during teenage, it went off, it is resurfaced again. So late onset acne or persistent acne has become much more common. So the age group that we see daily, it ranges from somewhere from 14 to 15 years to now 35, 40. So as with the lifestyle and the environment is changing, we are seeing more and more number of patients above 25 years coming to us with this complaint of acne. So acne is not just a teenage problem. It's a chronic tendency, sometimes reflecting much more. I believe so that with growing westernization, Western dietary habits like eating a lot of refined sugars, processed foods, sedentary lifestyle, late sleeping hours, and a growing rate of hormonal imbalance in young women has definitely led to a resurge of acne. I seriously believe that lifestyle plays a huge role in the course of your acne. Not only the course, the type and the resistance to treatment is also dependent on your lifestyle and daily routine. So if you're eating a lot of refined sugars, processed foods, if you are a couch potato, you're not exercising enough, you're sleeping late hours regularly, you lack discipline when it comes to your sleep and dietary habits, it definitely plays a role in causing acne. If your menstrual cycle is not regular, or there is too much of smoking, recreational drugs and alcohol use, even that can trigger acne or make your acne more resistant to treatment. There are evidence now to prove that aromatic hydrocarbons released from automobiles can definitely trigger acne formation. Free radicals generated by both indoor and outdoor pollution can cause hyperproliferation and blockade of your oil glands, and hence we strongly encourage patients to use antioxidants in topical and oral form, and we do see a good response in some patients with just a daily dose of antioxidants. So your daily pollution, both indoor and outdoor, does play a role in triggering or perpetuating acne. Certain cosmetics contain ingredients like isopropyl myristate, lanolin, paraffin, squalene, glycerine, dimethicone that can trigger acne and are not meant to be used if you have a tendency for zits or pimples. But sunscreen perhaps is an exclusion. Sunscreen not only protects your skin from the damages of sunlight and prevents you from tanning, it also acts like a pollution screen. You definitely have to choose a light textured, smooth textured, microfine sunscreen with a higher SPF. It will not only protect you from pollution. If you're on a treatment for acne, it does prevent certain complications, because most of the treatments for acne make your skin sensitive to sun. So sunscreen would be a part of an ideal regimen to prevent or treat acne. I would always discourage and desist patients from doing some skin engineering, picking, squeezing, rubbing or scrubbing pimples. Scrubbing, squeezing or picking pimples is going to make your acne or pimple go deeper. It's going to leave you behind spots that do not go away with most the treatments. It's going to increase the inflammation in the surrounding skin. So I would advise you against manipulation of your pimple. In case you are very much interested to pick your pimple, I think we should leave this job best to a qualified dermatologist. Picking, squeezing or manipulating the pimple only makes the inflammation go worse and deeper, hence aggravating your acne. It also increases the risk of post-inflammatory hyperpigmentation or the black spots that we all dread about. So I would strongly encourage against picking, squeezing, rubbing or even scrubbing the pimples hard with your hands or towels. I would say an ideal sunscreen is the one that you want to use again and again and again. That means something that goes well with your daily routine, something which is light textured, which is non-comedogenic, which has a gel or anti-shine effect, is an ideal sunscreen for an acne-prone skin. You can opt for tinted formulations in order to sometimes hide, or if you are interested to use a foundation apart from sunscreen, you can opt for a physical sunscreen if you want to go for options that do not make your face more oily. So a mattifying, gel-based, non-comedogenic, high SPF, SPF 50 or more would be an ideal sunscreen for an oily skin. An ideal sunscreen is the one that you would like to use daily and daily and daily and thereafter. So it depends on your skin type. If you have dry skin, you can opt for a cream or emulsion based sunscreen. If you have an oily or acne prone skin, you can go for mattifying gel based sunscreens. If you're using sunscreen for hairy parts of the body or for your bald scalp, a gel based or a spray based sunscreen would be an ideal. So it all comes down to your skin type. And the best way to decide your skin type is to ask yourself the question, how is your skin when you get up in the morning? So if you feel it is flaky or it is sensitive in the morning, you can also opt for physical sunscreens which do not have any chemicals and are meant for sensitive subtypes. A SPF of 15 or more is recommended by the American Academy of Dermatology to protect us against the risk of sunburn. SPF 30 or more is what I recommend for an Indian, Hispanic, African American skin. A higher SPF sunscreen definitely adds to the benefit, but in Indians, sometimes it can lead a whitish cast. So you will have to choose a formulation with high SPF carefully.